Hi, I'm Dr. Amie Bend, and I wanted to answer the question, what is thoracic kyphosis and posture distortion, and how can that affect your health and well-being? How can we as chiropractors help you with that? So let's look at the image here is what a thoracic kyphosis looks like. The image on the left is the ideal look of a healthy lateral thoracic spine, and the image on the right obviously has a bigger arc in it, and that is called a kyphosis, which means there's too much curvature in the spine. So when we look at the body, we are seeing bone. However, there are soft tissues involved with that. So when you're looking at the thoracic spine, you're going to be affecting your heart, your lungs, and your stomach, your lower extremity, and it'll affect your shoulders and neck as well because it's supporting the posture below your shoulder area. Pain that you may experience if you have thoracic distortion or postural distortions in the thoracic spine or mid-back can be neck pain to arm pain, shoulder pain, rib pain. You may have low back pain as a result of thoracic distortion, chest pain, organ pain, so it means maybe under your ribs. May also experience stomach aches and leg pain. So the thoracic spine is the base of where your posture is stabilized. So you need to have a nice stable thorax in order to have a stable low back. You need to have a nice stable thoracic spine in order to have a stable cervical spine. So this is an example of a fairly neutral thoracic spine. How would you tell if you're healthy or if your thoracic spine is contributing to your problem? Well, we would have to do an examination on you. We would do an x-ray, orthopedic testing to determine is your posture and is your posture distortion affecting how you feel and is it causing your pain. Now, once we find out that it is a thoracic issue and it is a posture distortion and it's a condition called subluxation, which is you have nerve impingement, we may correct it in various different ways. I might use an instrument called an impulse. We might do hands-on adjustment. We might use an instrument called an activator. So there's various ways for us to treat and deal with a thoracic kyphosis. So part of that would involve adjustments. Part of it would be posture stretches to stabilize your core and your back. Additionally, you may have more exercises to strengthen your extensor muscles. So some of this is active movement and some of this is more passive, like the one on the bottom. Mirror image correction would definitely be a part of our protocol. So we would look at your posture, we would analyze it, we'd x-ray it, and then we would measure it, and then we would give you a program to work through. Certainly, I have patients that are closer to 90 years old. They're not going to get the same program as a 25-year-old athlete. Now, when you have this distortion, on this view, you will see a healthy-looking nerve root. Okay, it's relaxed, it's healthy, and the nerves are flowing out like a fire hose might. And you can see that's where the nerve is at. When you have a stretched posture, like the image above, you can see that the nerve flow is being stretched out and thinning the actual neurological vessel, and then therefore your body cannot communicate as clearly to and from the brain. So this could be going to your heart or your lung or your organs and may affect how you feel. So this is why your thoracic or posture in any part of your body can be a part of how you actually feel on a daily basis. So in this image, we're looking at postural distortions. And so you can see that this person has a distorted trunk where her body's rotated over. Her trunk is her lower half where your swim trunks would be. And then as it related to that, her thoracic spine has translated over. And in this example, it may affect your posture, can affect your physiology, it can affect your hormones, it can affect headaches and blood pressure, it can affect many things in the body. Okay. The nerve flow here also can go to discs and reproductive organs. This is the lumbar area, and then on the top images are the thoracic area. That's number 12 and number 11 thoracic. Here's an example of the trunk shifting out of alignment. Okay, and again, the lumbar spine is attached and adjacent to the thoracic spine, and this can affect how your low back feels, and it can affect how your neck feels and your upper back feels. Here's a picture of the same person's body as it would lie over the skeleton. So the way we fix it is through mirror image stretching. So here's a forward head posture. So this person's going to stretch their head backwards. They're going to lie on a adjustment table with a bolster underneath and get adjusted that way. And they may also do more stretching. Okay, that's considered traction. Another way we can handle this is through stretching. If it's a thoracic or cervical translation, you just mirror image stretch it, mirror image adjust it, and do passive stretching so the patient can recover. All of this is catered to each patient. Vibration combined with mirror image exercises and adjustment will help maximize your results. So we may have you stand on a vibrational plate in our practice, or these are some examples of items that you can get that vibrate that can help you with your posture correction in addition to whatever we recommend for you. I'm Dr. Amie Bend. Our practice is in Arroyo Grande in the Village Creek Plaza. Our number is 805-474-4747. We have lots of YouTube videos. We provide x-ray, cold laser, posture correction, vibration therapy, activator methods, drop table. Children and infants are welcome in our practice. Nutrition supplements, decompression therapy for herniated discs, and also personal injury care. If you have any questions, contact us through our website at ArroyoGrandeChiropractic.com. Thank you.